go.
Bien,
So it's going to be Anna Maria to me, to you, Brian, and
Está
then to
bien.
Alex,
Está
Judy,
bien.
and Tom.
¿Está bien todo?
Yes,
Okay. Can I go?
yes,
Sure.
sure. Good morning, everyone, and happy Friday for all of you. My name is Ana Maria Flores. I am the proud director of Home Care Center in Union City. I'm being a director of the center for the past 20 years. I'm extremely honored, exciting, and blessed to begin here today to receive the first Johnson & Johnson vaccine in Union City. This vaccine will now be available to our community thanks to the Governor Philip Murphy and our wonderful Mayor and Senator Brian Stack. I want to express my sincere thank you to and the gratitude to the Governor Murphy and our Mayor for their leadership and concern about the community that have been so significantly affected by the COVID-19. Thank you to begin concern about our people in Union City. And now, it's my pleasure and honor to introduce the Governor Murphy. Our friend for all Union City residents.
God bless you.
God
Thank
bless
you.
you. There you go, Anna. There you go.
Let's make
You'll be
sure
taking-
Anna Maria's.
There you go.
Thank you for pinching.
Absolutely.
Good afternoon, everybody. Let's hear it one more time for Ana Maria Flores. Wow. Wow, wow, wow. I promise you I'm going to speak fast. I want to thank her. We witnessed Anna Marie and 5 other folks get the first Johnson & Johnson, among the first Johnson & Johnson vaccines, and it was a moment of magic. I'm incredibly honored to be joined by the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli, Union City Mayor and Senator, dear friend Brian P. Stack, Hudson County Executive Tom DeGeese, and the man of the hour, the Chief Executive Officer of Johnson & Johnson, Alex Gorsky. We're also joined by a number of Hudson County Commissioners, Union City Commissioners, Assemblyman Raj Mukherjee, Weehawken Mayor Rich Turner to my right. I want to give a shout out to Union City Health Officer Janet Castro and my friend, the incomparable Justin Mercado. Real quick, and I promise I'm going to be quick, the numbers for today, 3,347 positives, the heaviest of hearts, 35 more folks have lost their lives. Total hospitalizations continue to go down, 1,881, ICU 389, ventilators 223. Those numbers have continued to trend down. Please God, they continue to. New hospitalizations 247, 249 live patients walked out of a hospital yesterday. Hospitals reported 26 unconfirmed deaths over the past 24 hours. Positivity rate is 6.62. We've got variants, Judy. We've got the New York variant. The UK variant is up, and there's a little bit of Brazil as well in the mix, and the rate of transmission is up slightly. This is a huge day in our fight to beat COVID. With Janet as our guide, Judy, Brian, Tom, Alex, and I just had the opportunity to look on not just at Anna Marie, but at 5 other residents among the first folks in New Jersey to get their dose of the Johnson & Johnson vaccine. I cannot possibly overstate how much this day and this vaccine is a game changer in our fight to protect residents, to save lives, and to defeat this virus. Moreover, it gives us incredible pride that this vaccine was developed by one of our state's most iconic and historic companies, perhaps the company, Alex, most responsible for our reputation as the medicine chest of the world, Johnson & Johnson. And we know, amen, we know that Johnson & Johnson was already in a strong position to meet our shared goals for vaccine production, delivery, and distribution. But we also want to give a shout out to their partnership with another New Jersey icon in pharmacy, Merck, to help it get even there faster. Because it requires only one shot, it does not require the deep freeze of the other vaccines in our arsenal against COVID. This vaccine gives us much greater agility in bringing these doses directly to communities that need them and to deploy them rapidly. With the identification, as I mentioned, of new variants that we know are in our state and can spread more easily and quickly, we are increasingly engaged not just in a fight against the virus broadly, but now narrowly in a race against time. And as it pertains to variants, as I said, we know that they are among us. This vaccine, Alex, I say this all over, was tested globally into the teeth of this virus in places like South America and South Africa, and it showed to be highly effective in preventing severe illness, hospitalization, and death. So we now have not one, not two, but three potent weapons against COVID, and this weapon from Johnson & Johnson especially is going to allow us to reach deep into our communities to bring the vaccine to residents, to ensure equitable access and equitable distribution, and to save lives in some of our hardest hit areas. And we'll be able to do it with just one dose. Let's also not lose sight of the fact that even with our vaccines at our disposal, we cannot let up on things like wearing masks, social distancing, washing hands with soap and water, other common sense steps like taking yourself off the field if you've been exposed or you don't feel well. Brian, to the entire team in Union City, Tom, to the entire team in Hudson County, thank you all for everything you've done to help set up these vaccination centers. And Alex, to you and your team at Johnson & Johnson, bless you, thank you, and congratulations. It's now my honor to introduce our host, the mayor, the great mayor of Union City, Senator, dear friend, Brian P. Stack. Love you, man.
Thank you. Thank you very much, everyone. Thank you for being here with us in Union City. Special thank you to my good friend, Governor Murphy. Special thank you to Johnson & Johnson's Chief Executive Officer for being here with us. So a special thank you to all that are here, my fellow mayors, the County Executive, Tom DeGise. We've had a great working relationship with the state, with the county, with our neighboring cities on really pushing this vaccine out there. We'll continue to do that now with Johnson & Johnson. I'd like to thank my commissioners, all the school nurses in Union City that have done a tremendous job day in and day out in getting that vaccine out at Colin Powell. We appreciate that. And just thank the residents for having us here today. We'll stay here as much of the day today, getting the vaccine out to our older population. Thank you to them for being here with us today. And just a great big thank you for recognizing that here in Union City, we've experienced severe cases just as we have throughout the country and the world. And Union City being one of the most densely populated cities in America, we saw the positive cases in Union City. So we appreciate the recognition from the governor and from Johnson & Johnson for being here. Thank you very much, everyone. Thank you, Governor.
Brian, you are the best. There's no mayor like you anywhere in the country, never mind New Jersey. And Brian makes a very fair point. New Jersey, the densest state in America. Hudson County, the densest county in America. And I suspect Union City may be the densest community in America. God bless you for all that. Please, again, help me welcome the man of the hour. I don't know where we would be without him, without his company, without his colleagues. To say that Johnson & Johnson is a New Jersey icon understates the case. They are here, as always, in our hour of need. Please help me welcome the Chief Executive Officer, Alex Gorsky. Bless you, man.
Thank you, Governor. Well, Governor, Mayor, most importantly, the citizens of Union City, thank you so much. I could not be more proud of this day. And Anna Marie, our heart is with you. To think 13 months ago, our scientists took some numbers on a screen and turned it into the vaccine that was administered today. Safe, effective, one shot. It brings tears to my eyes, but thank you so much. You know, the founder of our company that started Johnson & Johnson just 30 minutes from here, making Band-Aids and surgical gauze, could never have imagined that we would be here at this moment today. And on behalf of our 135,000 employees around the world, I can't tell you how proud they are, the blood, the sweat, the tears that have gone into making this day possible to really make a difference for the world, for the United States, for New Jersey, for Union City, and for the citizens and residents right here. I want to give a huge shout out to the partnerships. We could never do this on our own. But the partnerships that we have with the federal government, the state government, the local government, the distribution, getting in the South, the partnership that we announced with Merck this week, we couldn't be more proud And last but not least, to the first responders, to the nurses. My wife is a nurse. Seeing them today, the doctors, to make all that possible. Thank you, thank you, thank you. Because ultimately it doesn't matter until we get those shots in the arms. So let me end by saying, get your shot, wear your mask. We are so close to getting through this thing. Let's stay diligent, vigilant, right through the very end. And I know we're going to have a much better summer as we get through this. Thank you so much, everybody.
Let's hear it once again for the man of the hour, Alex Gorsky, Chief Executive Officer, Johnson & Johnson. Huge. Speaking of nurses, Alex, your wife, our commissioner, the first nurse in the history of the state of New Jersey to be the Commissioner of Health. Please help me welcome the woman who needs no introduction, Judy Persicelli. Judy has a PowerPoint presentation, should be more than 35 or 40 minutes.
Thank you, Governor Murphy. Union City Mayor Brian Stack, it's great to work with you. Hudson County Executive Tom DeGeis. Johnson & Johnson Chairman and CEO Alex Gorsky. I can't say enough about what J&J means to New Jersey and what this means to Union City today. The arrival of this vaccine is being heralded across the globe. But here in New Jersey, we have J&J, our icon, the medicine chest leader in New Jersey. And I want you to know, my aunt worked in the first Band-Aid factory at J&J 100 years ago, 100 years ago. But as Governor Murphy said, it is an incredibly proud moment right here in New Jersey. And I just want to say, to have a safe and effective vaccine in less than a year is a phenomenal, extraordinary scientific achievement. The studies of J&J vaccine shows it is 100% effective at preventing hospitalization and death, and 85% effective in preventing severe disease. That is an unbelievable scientific achievement. Thank you, J&J. I'm going to make this short because I'm really cold. Thank you to everyone that has made this happen. I sit at the Department of Health. We make the approvals for where the vaccine goes. To all of you here that operationalize this, particularly the nurses and the health officers, thank you so much. We can't do this without you. The achievement is wonderful. We're on a journey. We will beat this. This virus will go underground because it will have no place to go because of what you're doing. Thank you.
Judy Persicelli. I want to ask my team to look up at the apartment second from the top with the hanging plants and the Christmas lights. Next time, can we do the event up there in the sun, please? I don't know who that is, but I'm going to go up and ask him for a cup of coffee after this. Last but not least, please help me welcome the guy that runs this county, and he's been running it for years and years and years, and it runs as well as any county in the state or in America. County Executive Tom DeGees.
It's cold, and I'll be quick, but Gov, I got to say, you look like a South American revolutionary with that hat on it. Not that that's a bad look. I'm glad to be here. The turning of this page in this book of our fight here has a significant chapter that we are now entering. And I want to thank the governor for being up here, recognizing our efforts, the two mayors that are here also. You know, if one of us isn't safe, then none of us are safe. And these guys spend their entire day working on this virus, getting more dosages, getting more sites together. And it ain't going to do anybody any good unless they go and if we find arms for the vaccines that we're receiving today. So for all the people, make sure everybody you know, your families, the people that you go to church with, tell them how important it is for not just for them, but for all of us that they find a center like that and get themselves safe. Thanks a lot, Brian and the governor, for allowing me to participate.
Wow. Listen, we're supposed to take questions. Do you really have to ask me any questions, Brian? Because I think we're going to lose some people here. Real quick. I'm going to cut out vowels, consonants only in my answers. Number one, Judy will follow up with you on the dashboard. I can't give you an exact number, but the folks inside are among the first wave that have gotten the Johnson & Johnson vaccine. No observations on marijuana, but we'll come back to you when we do have them. I saw the same thing you did in Connecticut. Our partnership with other states has been really good, but it's at a sort of thematic level. It doesn't mean that we all move in lockstep together. If our numbers continue to get better, and again, we've got the variants in the back of our mind, and the vaccines, today the J&J vaccine is a game changer. They continue to proliferate over the next weeks and couple of months. I am highly confident we'll be able to open things up again. Brian.
Specifically on Connecticut, though, what do you see as the determining factor? Connecticut says that they would go to 100% capacity, still with masks. Why can't New Jersey?
I can't speak for Connecticut. I think I've answered it, Brian, but we follow, and Judy and her team are at the front of this. We follow a whole series of data, and as that data gets better, and we feel confident, we don't want to lurch forward and then have to step back. That's one thing we have avoided, and we just don't want to do that. I can't speak for Connecticut. If it weren't for the variants, I think we would be moving more aggressively sooner. But we've got Brazil, we've got New York, we've got the UK. We've got to make sure that we are not going to get overrun by that. As I mentioned a minute ago in my remarks, we're in sort of a race against time, and J&J gives us a weapon that is a game changer. Again, we'll get there, but I want to make sure when we get there, we do it safely, responsibly, and we don't have to go back at some point in the future. One more, ma'am. Yeah, I think the numbers, first of all, don't compare apples and oranges. This was tested. Alex and I have been on the phone for weeks, if not months. This vaccine was tested in the teeth of the raging virus, including a significant amount of the trial in South America, Brazil specifically, South Africa. And so you have to keep that in the back of your mind. Secondly, Judy said this, 100% effective against hospitalization and death, thank God, 85% effective against severe illness. But I'd love Alex to come in and add any more color.
Governor, I don't think I could say it any better. All these vaccines are incredibly safe and effective. And if you look at the data in serious disease, if you look at the data in South Africa, in northern Brazil, I would encourage everyone to be getting these shots, because the sooner we get shots, the better chance we have not only of keeping people out of the hospital and from dying, but also to keep these variants from mutating. So please get your shot as soon as we can, and we're going to be doing everything we can to accelerate and increase doses. Thank you.
So well said, and Alex said it, by the way, they're all good. So this is not, one over the other. These are three incredible weapons. No reaction other than God bless her. She is in my prayers. Anybody else? We good? I'll jump in, and Alex may want to join here, but Judy, I think you'd agree with us. This is a game changer. One shot, regular refrigeration. Within the next number of weeks, my guess is we're going to have a very significant amount of supply to allow us to get to places that are hard to get to. Homebound folks, seniors, 75 and up, deeper into the black and brown and underserved communities in our state.
And Governor, one thing that I would add is when we did our clinical trials from the very beginning, we designed this in a way with diversity and equity in mind. Over 20% of the patients in our trial were of Hispanic or Latino descent here in the United States, over 13% Black, African American. These communities have been hit too hard by this disease. We need to make sure we're doing everything possible to reach out, to help them to get vaccinated, and to bring this virus to an end.
Amen. With that, Anna Marie, you're walking away. God bless you. And to everyone who gets their shots, hats off to you. Mayor Brian Stack, thank you so much for hosting us. Mayor Rich Turner, thanks for coming over from Weehawken. Tom DeGise, County Executive Judy Persicelli, Health Commissioner Janet Castro, who's running the show here in Union City, the nurses, other frontline healthcare workers, and last but certainly not least, the man of the hour, the Chief Executive Officer of Johnson & Johnson, Alex Gorsky. Thank you all. Stay safe.
Thank you, everybody. Thanks, Governor.
Good as it gets.